Let's talk about nerve recovery after surgery. After any plastic surgery procedure, you can expect the body part we operated on to be numb, and we call that anesthesia. And depending on the extensiveness of the surgery, the numbness could last for days to weeks, for instance, after inverted nipple correction, or sometimes several months after a procedure like a breast reduction, tummy tuck, or liposuction. And the nerves recover at different rates, one side to the other side, and also different body parts. So after the period of numbness, which again is called anesthesia, you move into a different phase of nerve recovery where you could get little shooting, sharp, zinger-like sensations, pins and needles, kind of like when you hit your funny bone and you feel shooting numbness and tingling, but it happens more slowly. Those are called paresthesias. And then after that, you move into a different phase of nerve recovery where things feel weird and they often feel bad. And you may feel sensations that are not real, like an itch you can't scratch, or the sensation that your tissue is wet, sometimes burning sensation, shooting sharp pains out of the blue. Sometimes they're positional. Sometimes it could be related to how swollen you are. For instance, after a really salty meal, you could be retaining fluid for a day or two. And those unpleasant and unnatural sensations are called dysesthesias. Your nerves are firing off their signals and your brain is interpreting it as something which is not real. The good news is they're temporary, and it just means your nerves are waking up. In general, your nerves should recover in about a year or so. In some patients, for instance, after breast cancer reconstruction, it can be several years after a mastectomy before the nerves even start to wake up. Is there anything you can do to speed up nerve recovery? Well, no, unfortunately there isn't. If your nerves are really driving you crazy and if you're having hypersensitivity, which can be quite common after breast surgery, compression can help, wrapping with an ACE wrap or wearing a postoperative compression garment in other areas of the body. The main message is your nerves are going to do what they're going to do. You should get your full sensation back over time, and knowing what to expect and knowing that unpleasant or unusual nerve sensations are normal usually is all patients need to feel comfortable and like they're moving in the right direction.